trying to undo the ACA. Those two things do not work together. In addition, we have seen in the Trump administration budget a $900 billion cut to Medicaid, $500 billion to Medicare, and billions from Social Security. And in the face of the coronavirus, $700 million cut to the CDC. These are the issues that the Democrats have been fighting for. We understand that, just as the chairman said, these are real children, real families, with real hopes for the future for all of them, and that we can use our healthcare system to make sure they have many, many birthdays in the future. And with that, we will turn it over to the little lobbyists.
Thank you. Excuse yourself a little bit. Thank you, Vice Chair Clark. Thank you, Chairman. Good morning, members of the press. My name's Elena. I am here with my daughter, Xiomara, along with who you saw, our friends Aaron and Abby. On behalf of Little Lobbyists, we are a family-led group of families advocating for our children with complex medical needs and disabilities. And we are here today because we are concerned about the threats to the health care that our children need to survive and thrive. Xiomara here spent the first 5 months of her life in the neonatal intensive care unit. She was born with serious medical conditions affecting her airway, lungs, heart, and kidneys. She uses a tracheostomy to breathe, a ventilator for additional support, a feeding tube for all of her nutrition, and a wheelchair to get around and explore the world around her. I'm thrilled to tell you that Xiomara is thriving today. She is happy, kind, funny, clever, a little bit naughty. She goes to school and loves to play and loves to meet new friends and go to the playground and read books and paint, and that's all because of her access to affordable, quality health care. We're here today because there are millions of families like ours filled with anxiety and fear about our future because of this administration's relentless attacks on our health care and on the disability community. Most recently, the president's budget included a $1 trillion cut to Medicaid and the Affordable Care Act. There are millions of children like Xiomara across the country, children with pre-existing conditions. And many of our children have extended hospital stays or will require lifelong care that's easily costing over $1 million and more, sometimes even before they leave the hospital for the first time, just like my daughter. Before the ACA, 59% of workers with an employer plan had a lifetime limit. If the ACA is gone, lifetime limits would come back, making our kids uninsurable and left without health care. And that is quite literally the difference between life and death. Many of our children with complex medical needs and disabilities also rely on Medicaid, which helps pay for what insurance does not cover, including home nursing and therapies. The administration's proposed overhaul of Medicaid funding would allow for block granting, which limits the funding a state receives to a set amount regardless of how much is actually needed by Medicaid recipients, resulting in devastating consequences for millions of Americans, including our families. Our children, the Little Lobbyist children, all children, deserve a chance to be kids and a chance to grow up. So we call on everyone to reject the president's budget, to reject these threats to the ACA, to reject these cuts to Medicaid, and instead we ask you to protect and support our children with pre-existing conditions. Thank you so much for the opportunity to speak with you today. Thank you.
Thank you, Elena, and thank you, Xiomara, for your tremendous advocacy, for sharing your story, as well as your talents, your energy, your intellectual wisdom on behalf of not just Xiomara, but of course on behalf of children like her all across the country. When House Democrats say that we are fighting to lower health care costs, when House Democrats say that we are fighting to strengthen the Affordable Care Act, when House Democrats say we are fighting to protect more than 100 million Americans with pre-existing conditions, we mean it. And we mean it because of children like Xiomara. And we're not just fighting on a Democratic or Republican partisan issue. This is an American issue. It's a life or death issue. And that's why we're committed to this fight. Healthcare, healthcare, healthcare on behalf of everyday Americans. Let me now yield for any questions.
On the healthcare front, last year, Majority Leader McConnell said that if the healthcare laws are ultimately overturned, he claims the Senate would immediately pass legislation to preserve this coverage of pre-existing conditions. How do you respond to that claim, and would you be willing to work with Republicans on some kind of measure to keep pre-existing conditions covered if the Obamacare laws?
We're willing to work with Republicans to strengthen the Affordable Care Act, which is the law that is currently in place. And the notion that Senator McConnell, Senate Republicans, House Republicans, President Trump would somehow come up with a magical plan to protect people with pre-existing conditions when they have been determined for 10 years to repeal the Affordable Care Act, and we still don't see an alternative plan. They don't have a plan to repeal and replace the Affordable Care Act. They have a plan to repeal and displace children like Ziamara. That's their plan. And so we're committed to this fight until the very end, and we believe that the overwhelming majority of the American people are with us.
A number of your moderate members have expressed concern about Bernie Sanders at the top of the ticket, that it could cost them their seats and it could cost Democrats the White House. So what is your advice to those members, especially those in swing districts won by President Trump?
I'm going to yield to Catherine Clark for this question. No, I'll certainly yield to her, but I haven't taken a position on the presidential race. I'm aggressively neutral because anybody who emerges would be better than the current occupant of 1600 Pennsylvania Avenue, who is a total disgrace in my humble opinion. If Bernie Sanders emerges as the nominee, if Joe Biden emerges as the nominee, and all points in between, I plan to support that nominee.
But what advice are you giving to your members, was the question.
We'll have a conversation at the appropriate point, but we're committed to protecting and defending the House of Representatives. More to come on that.
I think the strength of our House members and what they realize is the connection back home to the voters in these individual districts and the priority that they have placed on protecting health care. And poll after poll shows that health care, even for our youngest, newest voters, is the predominant issue. And what we have today is that example. This isn't just about polling or different debate topics. This is an impact on real people's lives. And what our members, especially those in tough districts, have done since they were sworn into office is go home, talk to people, hold town halls, be available. That is why they are going to be successful in the fall. It's that connection and the priorities of the For the People agenda. Healthcare, creating great jobs, and getting corruption and big money out of politics.
Okay. Senator Schumer was talking about $8.5 billion for coronavirus over in the Senate. Can you talk a little bit about what you're looking at here, and also specifically, is there anything with New York that you are concerned about?
Well, I think we're concerned about the outbreak of the coronavirus all across the world, and certainly watching closely the efforts to protect and defend the American people from any potential outbreak here in this country, whether that's New York or the other 49 states and all of our territories. There was no specific discussion earlier today in the caucus meeting about the administration's request. My personal view is that it's inadequate and that the administration appears to have been caught off guard as it relates to addressing the coronavirus, and hopefully they will turn things around. Catherine Clark, of course, is a prominent member of the Appropriations Committee, and perhaps she has more to add.
Yeah, we are actually, I'll be leaving here to go to a hearing with Secretary Azar. And we are going to be asking some tough questions about this administration's preparation, not only for coronavirus, but how they have left our country vulnerable to pandemics. This is not something you can address when one hits. It is something that you need to plan for. It is public health prevention, and it is vital to our national security. And what we've seen this administration do is take out the coordinating pieces and a proposal to make dramatic cuts, $700 million to the CDC, and to come back now at this point and say we would like $1.25 billion in additional funding, but we're going to take another $1.25 billion from other areas of the budget that need our help as well. One is the low-income home energy assistance program that helps low-income people heat and cool their homes. This is not the way we approach a pandemic. You need to make plans, you need to have coordination in place, and you have to fund agencies over a period of years so that we are ready to address this crisis.
It's safe to assume that you are looking at some sort of appropriation that's more robust.
Exactly. And we will, we'll be exploring that today in appropriations with Secretary Azar. But the response of this administration is a true threat to the national security and health of Americans.
Yes.
On looking a little bit at 2020, with Sanders, the enthusiasm around Senator Sanders, should House Democrats be embracing these bolder progressive agenda items like Medicare for All and other proposals like that, since you guys have the majority?
Yeah. So we picked up 40 seats in a historic blue wave election to regain control of the House of Representatives, dealing with voter suppression, a flood of outside money from hard right groups, as well as extremely gerrymandered lines. And we picked up 40 seats in a historic blue wave election. So Democrats now control the House of Representatives. What was the agenda that we ran on in order to win? That we were going to fight for the people, lower health care costs with an emphasis on protecting people with pre-existing conditions, and a focus on driving down the high cost of life-saving prescription drugs. We were going to increase pay for everyday Americans and work on a real infrastructure plan to fix our crumbling bridges, roads, tunnels, airports, and mass transportation system. And that we were going to strengthen our democracy and bring it to life for everyday Americans. So we were very clear on our agenda in 2018. And the American people gave us the majority. And so our responsibility, as our members have been doing, is to keep the promises that we specifically made to the American people in a fully transparent, for the people agenda.
Two questions. One on infrastructure. Are you guys actually working with the White House right now on an infrastructure proposal? I have one on 2022.
Yeah, well, there have been ongoing conversations with the White House from the beginning of last year to try to reach common ground on a meaningful infrastructure plan, and we still hope to find common ground with them, as we've done in many other areas. We've worked with the White House on criminal justice reform. We've worked with the White House on the U.S.-Mexico-Canada trade agreement. We worked with the White House on paid family medical leave for military families and millions of federal government employees. We're always willing to find common ground, get something done with the White House and the Senate on behalf of the American people, and infrastructure is no different.
And last night at the debate, Pete Buttigieg said that if Bernie Sanders was at the top of the ticket, we could expect a Speaker Kevin McCarthy in 2020, after the 2020 election. Your response, do you think the Bernie Sanders nominee really puts your House majority?
I look forward to renominating Speaker Nancy D'Alessandro Pelosi on the floor of the United States House of Representatives in January of 2021 and making it clear that House Democrats are still down with NDP. All right, and let me just mention in closing that I want to thank Elena, I want to thank the little lobbyist, I want to thank Xiomara, whose name means ready for battle. And from the very beginning of her life, she's been ready for battle. The little lobbyists are ready for battle. the House Democratic Caucus is ready for battle for the people. Thank you.